I'm Dr. Snehal Kulkarni, Senior Pediatric Cardiologist and Director of Pediatric Cardiac Sciences, Fortis Hospital, Mumbai. I'm specifically trained in pediatric cardiology, that is, I take care of heart diseases in children. And as pediatric cardiologists, many times we have been asked a question, what are these holes in the heart? Why the babies are born with holes in the heart? And how do we recognize that one of the babies can have a hole in the heart? So the holes are either in the upper two chambers of the heart or in lower two chambers of the heart. Babies are born with these kind of holes in the heart, and how do we recognize them? So they usually complain of breathing difficulty. When they are small, they cannot do well feeding. Their weight gain is not proper, and many times they get hospitalized because of pneumonias. And sometimes suddenly one X-ray is taken which shows enlarged heart, and that is the way we diagnose there can be a possibility of a hole in the heart. Suppose the hole is small in size, it may not be detected. And many times the child goes for some other causes for a pediatrician's consult, or they have been diagnosed on routine evaluation during the school health checkup, and these children have been diagnosed to have holes in the heart. So can they be treated medically? Usually not, because they are structural heart defects and they need structural solutions for taking care of these holes in the heart. If the holes are small and the child is doing well without any weight difficulties, he is feeding well, sometimes we wait for a long period of time to see whether the holes can close on their own. But if the holes are large, we may not be able to wait because the babies are very symptomatic, and we have to close these holes as soon as they are detected and the holes are quite large. Most of these holes are quite large and they need surgical closure of the holes, and mainly before 1 year of age. If the holes are small, we can wait for some time and we may be able to close by around 5 to 6 years of age also. Some of the holes can be closed without surgical interventions, what we call it as a transcatheter closure of the holes. That is, we can close the holes without operation by putting a device into the heart. The important advantage is the children may not need to go open heart surgery. The recovery is very fast, and within a week's time, they usually can go back to school and resume their normal activity. So if the child is detected to have a hole in the heart or suspected to have a hole in the heart, there is a need that they need to go to a pediatric cardiologist, get them completely evaluated, have a detailed echocardiography, and then take a decision or take a consultation with a pediatric cardiologist to see when the holes need to be closed and how they need to be closed. Thank you.